Andrew Fortin Bass is my name. A tour guide in Sierra Leone. The current situation in Sierra Leone, it's very it's not encouraging because um, we don't have businesses going on currently because of the corona epidemic, which we are fighting globally. Um, there is no operation, tour operator or travel agency that is working currently because of the corona epidemic we are all fighting. And Sierra Leone is a nation with 7 million population. We are in tourism has just started to um, it has been one of the fastest growing area in terms of tourism destination where tourists are coming. But currently in Sierra Leone, because of the corona outbreak, we are not having nothing going on currently. The hospitality industry, which is the tourism department, is one of the most hit area that is currently facing challenge. Well, the Ebola outbreak was very alarming because we lost up to 3,000 plus people who died towards the Ebola outbreak by then in May 2014. And this epidemic, which is the COVID-19, the coronavirus, has just claimed 4 lives because currently, as a nation, we have 95 index case. We are in Western area, which is Freetown, the capital city. The Western area urban has the highest with 66 to date as I'm doing this interview, and other districts have started recording cases, but with only three, which is Port Loko with six, Kenema with um, 3 cases, and you also have Bombali have recorded 1 case, and Tonkololi as well, they have recorded another case. So comparison and the Ebola outbreak crumble the economy of Sierra Leone, and it leaves Sierra Leone with nothing to write home about because we lost all our health workers, especially the medical doctors. Most of them died to the Ebola outbreak. It's after the Ebola outbreak we started having other medical people coming on board. So the Ebola was more. Um, the Ebola was more harmful than the corona outbreak, this coronavirus, as it is for now, because we started recording case on the 31st of March to date, which is the 26th of April, which is the eve of our independence anniversary, because tomorrow makes Sierra Leone 59 years, and the Ebola claimed several lives, babies. It wiped out villages in the provincial area because it started in the provincial area by then. But this now, we thank God, it started in Freetown. We are able to um, do one or two things because when it started in the provincial area, there was no information by then about the Ebola outbreak. People were caring for the dead. People were caring for the sick. So this was the way they were how they get infected with the Ebola outbreak by then in Sierra Leone. But now we have seen a lot of things on the internet. So we have heard about, and our health workers are trying to tell us that we must adhere to what they are telling us, like to wash our hands regularly, and the government is encourage citizens to use masks going out to public places, and also we must observe social distance. And we are encouraged, if you have somebody that have body ache and other things, you must call the free line, which is the 1172 line. By then, when the Ebola outbreak was in Sierra Leone, these are all, when it started in the villages, these were all not out until later, that by then it has claimed several lives. So the coronavirus at is now, though businesses are shut down, there's nothing going on because borders are closed, flights are not coming in and not going out. Only flights who are like medical flights are allowed to come in. So businesses compared to the Ebola just like the same. We even have inter-district lockdown. It means people are not going out of Freetown, and those in the provincial area are not coming back to Freetown because government want to stop the spread of coronavirus. And it's the same, but compared to how people die, we only have 4 deaths for now. We have 10 recoveries, and we have 95 index case. So the Ebola was very, very ravaged on the life of Sierra Leoneans, where it keep almost all our kids at home, like what the coronavirus have done. Sierra Leone with a population of 7 million people. We are faced with health challenges wherein we have government hospitals in the other 16 districts. In Sierra Leone, we have 14 districts in the provincial area, and we have the western area urban, which is Freetown, the western area rural, which is the peninsula area, where we have the beaches and where we have the other things. And if we want to talk about if we are prepared well, Sierra Leone have an experience of the Ebola outbreak, so we cannot say we are prepared because the ventilators we are seeing in Europe that they are using to give to people who have difficulty in breathing, which is one of the things which is a sign of the COVID-19. Well, for the provincial areas, we cannot say our governments have been like able to have all of this, but we have medical practitioners working relentlessly to encourage people who have body ache, who are sneezing, coughing, and have difficulty in breathing with headache, for them to report to hospital, because the earlier you go to these places, the earlier you have the chance to survive. But we don't have better health facility, because even if we, as we soon to have over 100 or close to 300, we don't have places to keep these people. So that's why we want this corona outbreak to we were trying our best as we could to stop the spread of this virus, because as soon as other districts which have started recording these cases, the cases start to increase, the more scary it is, because in Sierra Leone social distance cannot work. We are living in a place wherein families are living in a single room and a parlor, wherein you can have up to 8, 9, 10 families living in these places. If one person is infected with this coronavirus, it means another family member stand the chance for them to have. And wherein can we have these people? Where can we put them? We don't have a better health facility in other areas. Freetown has little chance of having this one. People are feeling the heat because in Sierra Leone, businesses are closed, the borders are closed, business is not going in, business is not coming out, because our borders are closed with our neighboring countries, and flights are not even coming. And those who are here, like the hotels, the restaurants which are operating within the beach areas, and restaurants, even other places, are now shut down, because government is encouraging those who are doing business within the beach area for them to shut down, because we want to they want to control the spread of the coronavirus, because people cannot gather. They are saying the more people gather, the more chance we have the spread of this virus. So it's very, 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 very alarming, because there's nothing we have now, because business is not happening. Hotels, airlines, restaurant that was creating job for half of the population of youthful population that made up of the 7 million population in Sierra Leone. Out of 7 million, I can say like 40% of this population are youth, and most of these youth, and government cannot cater for all of its citizens in terms of creating job. And most of these young people are out there, we are working in these places. And now when this coronavirus outbreak is here, all of these places have shut down. Even those areas where people are doing their little business, like buying goods and services from the provincial area, because half of our food stuff is coming from the provincial area. Now governments are saying you need to have a pass for you to go to these areas. So currently there is a curfew wherein people are not encouraged to travel to the other part of the provincial area. You need to apply for pass. It has to take a process for you to go through answering fill all this form before it's given to you, probably by then, and it takes another time for you to have access. So we have all currently a lockdown wherein people are not encouraged to go in and out of Freetown, and those in the provincial area are not allowed to come to Freetown unless you have a pass. So currently in Freetown and in Sierra Leone, it's very, very, very difficult. As a tour guide who barely survive when tourists are coming in and out of Sierra Leone, and giving them tours and taking them to destination where they want to go through their packages. It's very difficult for me, because I've been through a lot. As a young man, I lost parents at the age of 9 to the civil war by then in Sierra Leone in 1999. Both parents were killed by the rebel, and I have to raise myself up, send myself to school, and I have to send myself to college. And we are in Africa, and as a young man with 2 kids to take care of, and myself, I barely survived by tour guiding. I've been paying my rent, my medical bills, and then taking care of these 2 kids. They were going to school. And now when we have the corona outbreak, and in Sierra Leone, when this outbreak started in China in December, And in February, the government starts saying if people are coming from Europe, they have to go through the 21 days period or 14 days of period of quarantine. So flights we are coming, but tourists we are not coming. So from February, I have not been doing tours till date. It has been very difficult, and in Sierra Leone we have peak and off peak season. And when it was peak season, the tourism is just coming up. It's still challenging, but purely now when there is nothing home to write about, I'm purely struggling because I have nothing to do. There is no job because I've been doing as a guide, taking people, and I don't know when this outbreak and when this pandemic will come to an end. So it's very difficult for me, and coming during the raining season, and I've not yet even paid my rent. My kids are starving at home because they barely survive to me, and it's very very challenging because this time there is no flights, there is no inter-district movement, there is nothing, and we are on lockdown, which make it very difficult for me as a tour guide back here in Sierra Leone.